and we've been in existence since 2012. And our focus is to bring education about end-of-life conversations, end-of-life planning, advanced care planning to the healthcare community and to the public. And in that time, we have often brought to the subject the POLST, the Physician Orders for Life-Sustaining Treatment, which is a bright pink document that is an actual medical order, as opposed to advanced care directives, which is documents stating people's wishes. This education has been really important for our community. And what we have noticed in that time is there is a need to have an availability of an ongoing document for individuals that is accessible by all of healthcare. And the best way to do that would be in the cloud. And that's been a conversation in California, and it's across the nation, but specifically in California. And the governor has recognized that, the legislature has recognized that, and they actually signed a bill into being to help that happen. And that's why we're meeting this morning. And that's why I have Dr. Carlo Reyes that's going to join us and discuss it for what that means, particularly for Ventura County. So I'm going to, if you'll bear with me, I would like to introduce him and tell you a little bit about him. He's an amazing individual. He is my friend. He is an amazing physician and an attorney and an entrepreneur. So Carlo is a practicing emergency physician and president, CEO, and co-founder of Healthy MedRecord. He graduated from Chicago Medical School in 1998. After completing his 5-year dual residency at UCLA in emergency medicine and pediatrics, he became an assistant clinical professor at UCLA. Carlo has served as the Vice Chief of Staff for Los Robles Hospital in Thousand Oaks. While working full-time as an emergency physician, Carlo attended Southwestern Law School, and Carlo continues to work as an emergency physician, is an attorney with Boyce Schaefer Maneri in Oxnard, and is an award-winning columnist with Emergency Medicine News, writing his own medical legal column called At Your Defense. Carlo also serves as a board member for the Ventura County Medical Association and is a steering committee member of the Ventura County Coalition for Compassionate Care. He routinely lectures for American College of Emergency Physicians, American Academy of Pediatrics, and other national medical associations. And in his spare time, he organizes medical missions to Honduras, India, Iraq through his nonprofit Healthy MedRecord, or Healthy Med Charity. So as I said, it is a big pleasure to introduce Carlo Reyes.
Thank you. That's very sweet of you, Terry. And maybe we could take out the bio moving forward. It makes me a little uncomfortable. But we're here today to talk about some exciting news, things that I think that professionals in our field have been waiting for a long time. How many years? 15, 20 years. It all started with advanced care planning generally, and the paper POLST specifically. Obviously, a critical aspect of delivery of emergency and medical care at the end of life and with patients with chronic conditions. But everyone in the field quickly recognized that there was a problem with the paper POLST, its ability to be mobile through transitions of care. And so along came the idea of having electronic POLST registries. Now that has been a very difficult road for many states, and especially for California. There are only a handful of statewide registries, and quite frankly, when they say they're statewide, they actually aren't. Several of the statewide registries are not as successful as we hope them to be. There have been problems with registries, probably the biggest of which is the electronic health record generally. The idea that electronic records do not connect people. They're really a platform for billing is how it was started. And so to try to transition electronic records to incorporate electronic POLST has been a huge problem. Several years ago, the California Coalition for Compassionate Care and the California Healthcare Foundation partnered to start a pilot in which a couple of sites would launch an electronic POLST registry through engagement of local hospital facilities in certain areas. Ventura County was one of these, one of the applicants for this pilot, and we got very close, but we didn't get selected. But there were some important things about our application that everyone recognized was critical to the success of an electronic pulse, and that was the grassroots efforts of all of us here now. I have no doubt that if we were selected, it would have been wildly successful because of the individual efforts and the collective effort of the Ventura County Coalition. It was a very compelling application. We had anywhere from 20 to 30 agencies, facilities that signed letters of support for Ventura County to be a participant in the pilot. And at the end of the day, there were probably more business decisions that were made that prevented us from being selected, not based on merit. So that was a difficult pill to swallow. It's part of business, part of life, to have disappointment. But I think we've all come to realize that with that disappointment comes growth and an understanding of how we can be better. Fast forward, I think it's almost 4 years later, and we see where we can be now because miraculously, in the face of the worst pandemic in 100 years, the state of California, through the governor, has decided, or at least recognized, that electronic pulse is in fact critical for our state. So what has happened is quite tremendous. For all these years, we've been struggling with trying to find ways to fund an electronic pulse, use models of funding in county efforts that can be replicated throughout the county and the state, none of which have been wildly successful. And so it's become recognized that the state actually has to help fund this. And so what has happened is that the governor has signed a bill to allow state funding to support electronic pulse throughout the state of California. The specifics and logistics are yet to be laid out, but ultimately, with speaking with Julie Thomas and interactions with the Emergency Medical Services Agency, which is the state's agency that is controlling and administering the emergency medical services throughout California. Pulse will still be a grassroots effort, electronic pulse, partly because I think it was the recognition that Ventura County actually has the grassroots connections to be able to do it. I truly believe that what really convinced the California Coalition in terms of how to be successful is through grassroots efforts. And that is why the approach in the bill that was written by the California Coalition includes the engagement through local agencies on a county level. So what's different about this, and excuse me for really laying this out, because I think it's really important to understand the importance of the grassroots effort, because all of you are participants in this. What's really important to understand what's different about this compared to how, say, a hospital network launches an electronic health record. And maybe many of you, if not all of you, for all of you, this will resonate. This is through engagement. It's not through coercion. This is through understanding what's important about health and the delivery of healthcare, and it's not about dollars. This is about starting something because we find it critically important for our patients and our friends and our loved ones in the community. Electronic health record has been the bane of every provider's existence because it doesn't really support us. We are forced to write into this record because we are told we have to submit a document for billing, and it really lacks any heart in it, in a way. So having practiced emergency medicine for 20 years and understanding the importance of something like this, my company, which is comprised of physicians, nurses, decided to create an electronic pulse record. We built it over the course of about 4 years, understanding the importance of how to get the individual, the patient, the physician, the provider engaged together to support important medical decisions selected by the patient. And in which case we've launched it. It's been launched for about a year. And it is uniquely different from electronic health record. And again, this is something that the California Healthcare Foundation, as well as the California Coalition, has seen. They've seen testing. And what they want to do is they want to support individual communities that are engaged and ready to launch electronic POLST. So the reason why we're here today is for you all to understand the importance and also get acquainted with what we're trying to do in terms of the Ventura County Coalition's effort to launch electronic POLST. The way we envision and the way we see how everyone can engage is really, one, understanding the importance, two, understanding how different it is to launch an electronic POLST registry compared to an electronic health record, and three, to continue to support and engage as we launch the county, Ventura County. So we've had some initial discussions with several key participants, okay? Probably one of the most important participants in this is going to be the Ventura County Emergency Medical Services, because in those situations that of emergencies, when it could be end of life or a chronic condition or someone who becomes sick very quickly, whether it's in a skilled nursing facility, assisted living, the home, or a hospice agency, it's really the paramedics that really need to understand the electronic POLST and to be able to have access to it during those emergencies. So with that, we've had discussions with Dr. Daniel Shepard, who's the director of Ventura County, as well as Santa Barbara County Emergency Medical Services. We showed him the electronic POLST here in Ventura County. We showed him the importance and the types of engagement that we can provide through hospitals and outpatient facilities, and the Ventura County Coalition, as well as the California Coalition, and he is excited about it. So the way the bill is written is that it's the EMS services that are really going to be pushing and advocating and administering the electronic POLST. So obviously we had to partner with Ventura County Emergency Medical Services, which we are engaged with now. The plan is to roll out a registry around each hospital. And what I mean by around each hospital is that as each hospital becomes ready, demonstrates their readiness, and I'll define what readiness for a hospital means. As each hospital demonstrates their readiness, then the Ventura County EMS will deploy electronic POLST among all of its rigs and paramedics that service that particular area or that particular hospital, okay? And then at the same time, we need to get everyone else engaged, all right? So what does hospital readiness mean? Hospital readiness means leadership, field of care, emergency physicians, hospitalists, and intensivists in that hospital, already in understanding, one, the importance of electronic POLST, two, the buy-in in terms of understanding the need to know this at the time of emergencies for their patients, and then three, have the ability and have implemented and integrated electronic POLST into their workflow. So that's the readiness. Also included in readiness for hospitals is having local facilities around that hospital also equally engaged. So that means skilled nursing facilities, assisted living facilities, hospice agencies. So any of these patients that are for which electronic POLST is relevant, they have buy-in as well. So when a hospital demonstrates that level of readiness, that is when the Ventura County EMS will deploy electronic POLST, in which case everyone, the whole continuum from home or outpatient setting to paramedic ambulance transfer to inpatient care, all the stakeholders are ready to launch POLST, okay? So I am the Assistant Director of the Emergency Department of Los Robles. I am assisting my fellow emergency physicians and hospitalists in understanding electronic POLST, and we are working towards that level of readiness. And we'll be reaching out to any and all agencies around Los Robles. That's where we're starting. We are engaging with leadership of every hospital in Ventura County to get all the other hospitals ready as well. The importance of this is that all of us on the call now have the ability to help in terms of that engagement and readiness for electronic POLST. And so with that, this is a call to action, because if everyone on the call truly does believe the importance of POLST and finishing, kind of like getting to the completion of what POLST is supposed to be, then electronic POLST has to be the way to do it. There's a couple of key changes. So that's kind of like the overview, the history, the general approach, okay? What I'd like to move to is really the key changes, okay? And one of them I've already told you. One is the potential, or not the potential, the actuality of funding that will occur. Okay, the funding is for the operation of the POLST. I don't know when it's going to happen. I don't know when the funding will occur, but it's likely to start funding sometime next year, okay? So no funding now. The funding will really be about supporting the deployment, the platform, and everything that is needed around that, okay? There's about $10 million that's going towards it, and that $10 million is going to be allocated by the California EMS agency. And so what that means is that California EMS agency is going to look at counties throughout California, and then we need to help them decide who's ready, that we're ready, and we're ready to start receiving some of this funding so that we could make ePOLST a reality. Okay, so that's one key difference. For the first time, we're actually going to have some funding for this. The second thing that's key is that through discussions with the Ventura County Coalition, we've decided to become for ePOLST in Ventura County to become a nonprofit endeavor. So what I mean by that is that will allow us to fundraise to help support the registry. Instead of it being something where we charge or it's charged, it's actually going to be free. That's another key component. It is completely free for Ventura County. There's a lot of faith in that statement, right? Because it costs money to run this. And, me and the owners of the company that built POLST, we built it with our own money. We have no funding. We have no revenue for it, but it was through passion and kind of a feeling that it was an important thing to do that we did it. And so there's a little faith in this, in the idea that I believe that if we get this running, then we could be an example for the rest of the state of California and maybe the nation with regards to how to fund a POLST through a nonprofit approach. So for Ventura County, it will be free. What that means is that for the unforeseeable future, there'll be no cost, with the idea that since the state of California is going to be funding it to some degree, their funding will help to some degree keep us going. So that should open up the ability for hospitals to engage, for any facility to really see the importance and see the benefit of something like this being available. This could translate into a statewide registry in which every physician, every resident has access to their own POLST at any time, and that could be a means of the basis for, in a way, a mini health information exchange, where it's devoted to share only advanced care planning documents like POLST and advanced directives, etc. So I urge you to see or to reflect and see how this can transform healthcare tremendously. It's going to be the first time something like this is happening for the state of California. This will be the only nonprofit ePOLST registry in the state of California. That's another key component that's different. So I'm going to stop now. I just said so much and it's been a lot of information, and I see a lot on the chat. So I'm going to pause and have a drink and coffee and see how we're going to manage the chat.
So Carlo, all of that was introductions of each other into chat, and I just put in that they could enter their questions into chat. But I'm willing to take questions live if you would like to do that. I have a question. When you say everybody, how do you see that going forward with particularly, let's say, nursing homes?
So probably the last hurdle. Okay, we've taken care of the funding hurdle, taken care of the fact that we actually have a platform. The last hurdle is how to implement it, how to get adoption of a platform. And this last hurdle requires a couple things. One, recognition that it's important, but two, it's the engagement. It's getting our coalition together to understand the importance of helping the engagement of the facilities in which we work with. So if we're working with hospitals and skilled nursing facilities, if we interact with them, then we can help in terms of increasing the awareness of that importance. That's the first thing. The second thing is that the deployment, well, ever since the pandemic, it's amazing what you can do with Zoom now, right? Like lots of meetings can be in Zoom. So our implementations can be done remotely as well. So it's a very simple platform. It takes only about maybe 10 minutes to understand it. I think that getting the skilled nursing facilities engaged with it does require Ventura County EMS to basically say this is going to be our single source of POLST. So when Ventura County EMS says we're only looking here, then that's going to be a message to hospitals and to outpatient facilities. We need to engage with POLST Registry, which is now free. So there's also ways in which my implementation team can help in terms of understanding those workflows. A lot of it involves either having individual access to the POLST, having our doctors and providers understand how to fill out a POLST through the electronic registry, and then in addition, having the facility staff understand how to upload an existing paper POLST into the registry. So it's something that is going to happen over time. In fact, it ends up being the first step. Even well before EMS is going to look for a POLST, we have to know that there is a POLST in the registry. So the next 6 months, and again, this is kind of what the timeline should look like, right? The next 6 months should be engagement and then adoption through placing electronic POLST and paper POLST into the registry. And that's before it even goes live. We need to get that type of engagement with all the facilities.
So when you say all of the facilities, and I have other questions, Carla, to let you know that in advance, but when you say all other facilities, I'd like to push that idea. It's not just hospitals, it's not just nursing homes, but that would include hospices and possibly assisted living facilities, such as the large ones and the board and cares?
Yes, absolutely. Any facility in which POLST may be important at the end of the day, right? So there is a certain level of trying to understand what are the key elements initially, and it's going to be Ventura County EMS being trained to use it, but that's actually further down. It's really getting the POLST populated. So yes, all the outpatient facilities and hospitals. And at the end of the day, the POLST, the electronic POLST is no different from a paper POLST. It's just accessible. The only difference is that it is electronically accessible, first of all. So the form that you fill out on the paper is the same form that you're filling out electronically in the platform. You just need Wi-Fi or cellular service on any device, a mobile phone, tablet, desktop, laptop, and then secure access that we will be providing through the coalition, and then a brief introduction to the platform, and then you're ready to go.
So is there any difference between the electronic POLST and the paper POLST? What if I have a paper POLST already and I don't feel like I need to update it, or the physician and I don't feel like we need to update it?
Well, that's a really good question. At the end of the day, any POLST is something that needs to be recognized, paper or electronic. And this is going to be a transition. It shouldn't be the case that EMS should ignore paper POLST that are being shown to them, certainly. The only difference is that if a paper POLST is not available, then EMS will actually look in the electronic registry to make sure it's not there. And then over time, the electronic POLST, as it gains acceptance, will be recognized as a single source.
So I have a really important question that I think may not have been clear. I had a question that, have all local ER groups agreed to this process? All the emergency room groups, have they agreed to this?
So this is part of the engagement, that the initial engagement. This is actually, as far as this meeting, this is the first time we're formally announcing what our plans are. Our steps of announcement is first the general meeting here, then we're going to move to key stakeholders, which will include emergency physicians of each hospital. So as an emergency physician, I know all the chairs in the emergency departments of all the Ventura County facilities. We've had engagements before. In fact, several years ago, when we were applying for the pilot, all the emergency physician groups were in alignment and signed letters supporting electronic POLST. That really should be no different now in terms of the support of electronic POLST. So yes, emergency physicians, and with my experience, and I know all of them, I would imagine they would be very excited and supportive of electronic POLST.
That's true. I have two questions here, and I'm trying to figure out which is, they're both important, but I had a question that said, do we need to form ethics committees to discuss this and to work with that? And I think as an ER doctor and different people, I see Diana Hawkes on here, and that would be a discussion to have. And I see your name raised, Diana, so answer your hand raised. So can you answer that, please?
Actually, the ethics portion of this has already been rolled into the initial development of the POLST form itself. This, the POLST form became law back in 2010. I mean, it's been in place for a very long time. It's less about the ethics of having it available than it is just about the accessibility of using it. And I think that any ethics committee, if they were involved in this from this point forward, would clearly say that absolutely, yes, this is the best way to honor what a patient has previously stated. And it's really to reflect that thoughtful conversation between the physician and the patient about what they value. So developing an ethics committee around this now, I think, is less important. Now, developing a committee at the implementation of the POLST form itself in the very beginning, they were very involved at that time. So, but that wasn't my only question. You can get back to me after we finish this section. Terry,
Terry, I think you're on mute.
Go ahead, Diana, with your question.
Okay, I do have a question, and I didn't want to disrupt the flow of what Carlo's saying about our involvement and kind of that call to action about how to engage all of our organizations in this call for how do we develop this and how do we bring this on board for our entire county. But I also would like to set forward a parallel call to action. And that is really for each one of us individually to look at how we're going to take the other side of this coin, and that's the education around the importance, how to fill it out, the physician education, the patient education. How are we going to do this in parallel? What your organization can contribute to that, what you as an individual can contribute to your organization's commitment to that. What I'm seeing now is especially, we did a survey that I know that Carlo and Terry reviewed at our last meeting the results of the physician survey and then the patient survey around COVID. And the one thing that really struck me was if we did not have a commitment from physicians and an understanding by patients about the need to fill out a POLST form amidst the pandemic of COVID, we are really missing the boat as far as that education piece. We've got to get that education out. And we have to make it more robust, because we can have the best plan in place to have it electronically stored, but if the physicians aren't filling them out, we're going to have very few in the queue. And as we look at this, I want to have you think, how do we make a parallel call to action, a parallel commitment for each one of our organizations to include in our county's effort around education? Can I just give you a quick little summary of what we're doing here at CMH? Over the next 30 days, we should have a video available. We have 6 physicians, well, 5 physicians and myself, speaking in 10-minute segments. We are doing a 1-hour CME for the physicians, and that will also be a 1-hour CEU for nurses, for anyone else who's licensed. It is 6 sections of 10 minutes each. And each 10 minutes has a specific portion of why it's important and how to complete a POLST form, who it's appropriate for, what do you do, how do you bill for it, what do you, all of the particulars that really should lead a physician into understanding the importance for a patient, the importance for their practice. Then how does it benefit their patient's flow as they go through their disease? And then how do they get billed for? How do they bill for it? Where do you store it? What do you do with it? And in that last 10-minute segment, we are going to talk strongly about the electronic POLST registry that's coming. We're going to talk about what do you do today? What do you look forward to in the future? And how can they help to push this forward with the understanding with their colleagues that the best resource for your patient and the best way to support your care plan for your patient is to have that available at the emergency room or with EMS when they hit the door. So it's going to be a 1-hour segment, and when that's done, we are sending it to the county.
Thank you, Diana. That you actually lead into a comment that there's a physician online who had a question. This sounds like a great next step. It sounds like it's not a stage to include a physician in a small community practice, where I would like to counter that and say, I believe every individual physician that can take part in this would make a huge difference. Am I correct, Carlo?
Oh, 100%. Because I think each of us can be models for engagement for our people at the end of the day. So for each ER physician that signs up, it's a model for the rest of the ER physicians of Ventura County. For each outpatient physician, it's a model for everyone else. So I think that would be critical to share the stories of this too. The early stories of how your experience with the adoption, your first patients you put in. This is one of those things where the Ventura County Coalition can continue to share these stories for all the facilities and the providers, so that they say, okay, this actually is working and people are engaging and using. So yes, in the coming days there'll be links to the website to understand, links to sign up, and certainly Terry, we should collect all these stories and do follow-ups and find out, like on an individual basis, how did it go? What are your roadblocks? Where are the problems? Because I think as each individual learns how to master the kind of the workflow of electronic POLST, and that story can be shared to everyone else, and then the adoption will just take over at a much faster pace. Absolutely.
And agreed. And so all of the information isn't out there. And there's a follow-up question or comment that there are practical medical ethical issues, such as how to change the POLST in the registry. What if an institution uploads a POLST and the patient and personal physician don't know this? Will a PEEK form on the fridge get superseded by an electronic form? And so that's part of why we want an old electronic upload. So that's part of the reason we want to go to the one source for the electronic registry. So we always have the updated form. And Carlo, if you could take just a couple of moments to explain how this works more efficiently than the paper form when they are on the electronic platform. First of all, let me say,
Okay.
before you do that, that a paper form, an old paper form, can be uploaded to the platform from a PDF form, correct? Yeah.
Correct. So all those paper forms are not wasted. Once they're put on the platform, then they're viewable. The key difference between electronic and paper, obviously, is the survivability of that form no matter what. Meaning a paper form gets lost, a paper form is forgotten, right? Whereas an electronic form, once our providers, our paramedics, and everyone are trained to open it, then it will sustain and survive through anything. It won't be lost or forgotten because it'll be there. That's the first thing. The second thing is that the latest date rules, whether it's paper or electronic. So let's say something weird happens and someone puts a paper POLST, and the date of that paper POLST is more recent than the electronic. I'm not sure why that would happen, but at the end of the day, it's that latest POLST by date, which is the one that should be followed. So anyone that opens up a POLST will be trained to say, okay, where is the POLST? In the initial stages, it'll be looking for paper. If there's no paper, let's look at electronic. And then if there's a paper and electronic, it's just looking at the date. It's really no different if someone stumbled across two paper POLSTs. So from that perspective, it's always looking at the latest one. In terms of the logistics, that's who I'm working with the Ventura County EMS in terms of the logistics of looking it up. And so we're coming up with a couple of interesting ideas to streamline paramedics to look at it without too much difficulty. We have some pretty interesting ways. There's new technology where you could hover a phone over a bracelet and it'll pop up a POLST, or let's say QR code. So we're investigating a couple of interesting ways to do it that again will be somewhat groundbreaking and brand new compared to the paper POLST. So a lot of these workflows that we're actively working on in the ensuing months is going to be basically approved by Ventura County EMS, and then we'll move forward in that direction. The only other workflow is the entry of electronic POLST, whether by paper or by electronic form. And I wanted to kind of pull in what Diana was saying about a second parallel call to action for education. One of the key components of an electronic POLST is its ability to assist in filling out a valid POLST. And by valid, what I mean is there's no inconsistencies. It requires signature. It requires notification of both the physician and the patient that are signing it together, right? There's always been fear about these paper POLSTs are invalid because they're filled out and not signed, right? Or that they're signed and not filled out. In either case, they're invalid. That's not possible through an electronic POLST. That's the first thing. The second thing, it has incorporated into the electronic POLST the ability to enhance the conversation through clinical decision support, instructional video, definitions of what a particular entry means. We've gone down to what grade level did we go down to make sure that every person that fills out the POLST will most likely understand it. I think it's like
Sixth
fifth grade or something.
Mm-hmm.
Yeah. So there's a lot that's built into this platform. It's not just, fill in the entries and, whatever is entered is accepted. Meaning there's intelligence in the platform that prevents both inconsistent and incomplete entries into an electronic POLST. And that is huge. That is a huge aspect of assuring that the conversation is had, that the patient that signs it understands it, and that both the physician and the patient are signing it.
So, Carlo, that leads to a question. Somebody said, how will the electronic registry accommodate those who do not speak English? And how will those be translated so that EMS can access and understand them? And I know that we have that translation online as possible, but I also want to go back with a little education about the POLST and the advanced directive. Both of those legal documents can be done in another language, but the one that is signed is done in English, and so that those who are reading it understand it. If I need to be corrected on that, please do, Diana, but I believe that's correct. And Carlo, can you explain further how this would work on the electronic POLST registry?
Yeah, so any completed POLST form that's presented to a provider will be in English, just because of the presumption that everyone speaks and reads English that is providing healthcare. Secondly, when you're counseling a patient with a different language, the platform currently accommodates Spanish. It doesn't take much to add additional languages. So as we roll it out and as we get more adoption, we will add more languages, but it requires the input of everyone here, as well as all the users of the platform, which ones will be next. I mean, we can kind of guess which ones, but at the same time, I think there's going to be a lot of engagement with the users. So that brings up a related point. Part of the commitment of the implementation team is to get that engagement, that user experience, understand it, update it, make it better over time, but including it's going to be asking questions like, does the platform make sense to you? Is it intuitive? What languages do we need to add? Are there any other features that need to be added? So there is a very active engagement that we will kind of initiate with all the users of the platform in Ventura County.
So I have somebody said POLST, Diana put in here, POLST form is available in multiple languages, and the ePOLST registry will soon be available in other languages besides Spanish, and that we know from our meetings. Somebody had an interesting question, and I do think we need to address it. What happens if the internet is down? Seems that a hard copy might still be necessary.
That's an excellent point. I think it depends on a couple of scenarios for that to happen. For example, a hospital internet, I've almost never experienced down. Theoretically, it can happen. So within the hospital setting, I think that it's one of those things that we most likely won't experience. Okay. Secondly, cell service. So you could use cell service to access this through a smart tablet, smartphone. Again, the chances, certain regions, there might be pockets, you know, kind of like those black holes. But as soon as you enter into an area where there's good cell service, it will then be accessible. I think it is more likely to have delays in getting the form rather than not being able to get the form. And in a way, this is one of those things that is probably going to be less, at the end of the day, comparing that type of limitation compared to the systemic-wide limitation of not having a paper POLST or missing a paper POLST or having an invalid POLST or an unsigned one is far more of a problem than the transient limitation of poor cell or Wi-Fi service, if that makes sense.
Carlo, I'm sorry. I thought I'd been signed out by my husband, so I freaked out and had to check on that. I apologize to everybody. There is somebody asked a question, and I never thought of this, and I don't think it matters, but I think you would have a legal answer. There's a language on the POLST consenting to be on the registry.
Yes. So when you register to be a user, so it's just like any HIPAA secure platform. First of all, it's HIPAA secure. You have to provide some initial information. So part of the onboarding is going to be, it's almost like when you're on Facebook. You have to have some security questions. You have to pick a username and a password. It's no different from any social media site. Once you get through that, then you have to agree to the terms of use, which does basically include, I agree that my personal information will be in this registry. And then for the providers, I agree that this is secure, private patient health information that I will keep secure and only, you know, so it has that kind of legal language in there that allows the legal transfer of HIPAA secure information, such as patient information.
Great. So The last question, or maybe it may not be the last, but the question that comes up now is, what do you need from us now? How do we advocate for this?
Great. I think it starts in your home. I think it starts with your circle. I think it says, what I think is that we get our loved ones to sign up. You know, if we have a loved one that for which POLST is relevant and important, we help them put a form in there. So this is not only just accessible to the healthcare users, it's accessible to individuals and their family members. So family members have we're going to be rolling out a family member access so that they can also see the form as well. So there are layers to this that we can grow the usership of the POLST platform, and we start with just, you know, my parents are on it, for example. It starts with all your, then it moves on to your peers, your wider circle, right? The people you work with, you know, for which POLST would be relevant. And then at the end of the day, it's all our business connections and all our kind of daily work connections. You know, if you work with facilities and it makes sense for POLST to be there, just let them know, share a link. There'll be a link that will be shared, say, hey, Ventura County is doing this, and I think that this is important for you guys. So starting grassroots really starts at your circle and then expanding that circle.
So, so Diana Hawkes had a great question, and I thought the same thing. To be clear, a physician or a nurse practitioner or a physician assistant must sign the POLST. So how can we advocate not knowing if they've had that signed? Do we go back to our physician and say, would you please sign this, go over the POLST with me, not just sign it, but have a discussion with me about my wishes, and then have it uploaded or go on the electronic POLST registry and put it in?
Yes, so individual access allows access to view the form, to look at the videos, to understand, to self-educate. Okay, it allows for you to open it up in front of your family and go over these questions, right? But obviously, at the end of the day, you need your physician or your provider to sign it. So there's the indirect engagement that becomes important. Going to your doctor and saying, I'm using an electronic POLST registry. I'd like you to sign up. It's free, and this is where I want my POLST to be. Yes.
So Carlo, also, that's the individual mandate to us. What about can we do to support the idea of having the state pay attention to Ventura County and send some of that $10 million to us?
I think this beginning stages is exactly that. First of all, no one else in California is doing what we're doing right now. Guaranteed. In the beginning, 4, 5, 6 years ago, there were these sites. There was this reported 4 registries that were active and open. As it turns out, we were the only kind of community registry open, right? And so there's really only 2 electronic registries open in California, and we're one of them. The difference with us is exactly what I said before, the idea that this grassroots was very unique and was very compelling. And that's actually, in my belief is, it's that experience that we showed to the California Coalition that really became kind of part of why the bill is written the way it is that it's going to stay grassroots. Where there, you know, counties that show readiness are going to be helped. I had a personal discussion with Julie Thomas about it, and she said, yes, the registries that are ready will receive help. So there is a call to action. There's a little bit of faith involved in doing this, but at the same time, that's how the bill is written. So we have inroads with our own local EMS, and they have bought into it. Not only that, I could speak for my hospital. There is interest for our, you know, as many of you may know, Los Robles has launched a residency program in internal medicine, and there's other residency training programs that Los Robles will be launching in the coming years. And so the head of the ACGME, Dr. Talker, who's basically the head of academics at Los Robles, wants to do a pilot research study between with, and the engagement is going to be with the Ventura County Coalition, Ventura County EMS, and Los Robles Hospital to push forth research that shows the importance of electronic POLST. So there is already a substantial amount of engagement. That type of engagement is going to be undeniably compelling for the state of California to recognize.
So that sounds like we need to have continual communication and updating on what is going on so that we can support each other in this and help Ventura County to come out ahead of it on top and doing what is right for our family, our patients, and for our healthcare community. In the long run, it does benefit the whole healthcare community also. And we don't like to talk about it, but it does help the healthcare community coming down to dollars also. Saying that, I am asking everybody who would like to continue to hear more about this, participate in it, learn more, and be kept updated. If you would please put your email in or notify me personally in my emails, you all have them, that we could make sure that we have an updated list to do that. I would also encourage you to become members, and I don't mean this as a hard sell, but it would be very beneficial if you would become members of the Coalition for Compassionate Care and help us to be able to maintain this information. And we, you know, it's $100 a year for membership, and that would be starting in November through next year. And if you will send me your email, I will send you the form for that membership. And then somebody, and Diana put this in here, somebody put in here, Diana, you did, when we talk to physicians, if Ventura County is not selected, will all of the documents that have been uploaded be entered into another platform? And Diana, I believe that we will be selected, but it is a good question.
Yeah, it's a valid question. I think that the whole purpose of this being free is that it's available. So there will be nothing lost in engaging in this platform. Meaning if the state, the way the bill is written, that shouldn't happen. And I can allow me to be somewhat technical about this. The way the bill is written is that local or regional registries, the call to action for the registries is to connect to a central statewide repository through which the statewide repository will maintain the single source. So what that means is all the entry points for the polls could be through various different registries, but they will go into a single repository. So there is some cost to having that bidirectional transport of electronic POLST between a local registry and a central repository. And it's through that connection that will allow the single source for the state of California. But until that single source repository is made, then there has to be a single source within the county. So we, again, grassroots, we have to start with our single source here. Then we give up our single source to a statewide repository once the repository is built. The building of that repository is going to be through collaboration of the state of California, and the funding, lots of the funding is going to go towards that. So it's not like this $10 million is going to be, woo-hoo, we get to like share it with everyone. And it's not about that. It's really about building the infrastructure, much in the way that Tesla, okay, let me just use an analogy. Tesla built its charging stations. If you remember, Elon Musk built charging stations all over the country, right? And everyone's like, why are you building all that? And that was like 10 years before they even had any control market share of electronic, I can't even say the word, electric cars, right? Look at them now. They're dominating it because they had faith and they built the infrastructure. This is no different, okay? So counties that are forward thinking, that have a little faith in what needs to be done, are going to succeed in this, and we will probably be the first ones to succeed in this. I'd like to mention also that this call, I would like to propose that we have a ePOLST engagement subcommittee. Okay, I know some of us have, you know, we're all busy. Some have various ability to really engage, and some have more time and some have less time. But for those that really want to be an integral part of engagement, I propose that we call the general committee, the general meeting, those that really want to have that, to have particular engagement and have regular, I don't know, monthly meetings to talk to the steering committee, and then turn around and find ways through the community, through their connections to enhance that engagement throughout the county. So I think that would be a great way to move that forward too, because there are a lot of things, when you're the author of something and you stare at it all day, you can't think of other ideas, you're stuck. But we really need to get the engagement of as many people in this committee, in our general committee as possible, because I am certain that there are many things that the steering committee is not thinking about that would be fantastic to incorporate into the ePOLST platform.
Agreed. I will, the best way to do that might be to, as you become members, to look and have a membership interest of what you would like to do if you'd like to be involved in that subcommittee and the discussion of that and the education about POLST would be a good way to move forward with that. And also, let me offer, we are looking for people who would be interested in being part of the steering committee, but on a regular basis, because it is with that vision that we've been able to move forward and sustain who we are even through this time of COVID. So we are looking for those members also, and helping us come up with ideas of educating and moving forward with the Coalition for Compassionate Caring in Ventura County. Any other questions or comments?
I'm reading everything too. As well, I think that even after this, Sherry, maybe we could reach out to everyone. We're going to think of more questions. This is going to take time to digest, and
Yes.
maybe make this available as as a video to share. This could be one of the ways in which we could share what our plans are with the rest of Ventura County, because I know there's going to be evolving questions and really great ideas to move forward.
Yes. So I really appreciate Carlo being with us today. Every person who is here and the members, those future members, I really appreciate your time today. I know how valuable it is. And I hope you're feeling this excitement that we are moving forward on something that is so very, very important for our community, for our families, our friends, and for the healthcare system. Thank you so much. And I am going to ask those who are on the steering committee if you could just stay a few minutes afterward, and I will adjourn this meeting. Thank you.
Thanks, everyone.